Segment of the show for today. We're talking to Drs. Smith and Hayes, and they're giving us some information in reference to their background, education, and some of the things that have been important in terms of bringing them to where they are today. And of course, what we'd like to do, Dr. Smith, is to continue our discussion by having the two of you give us some information about some of the training that is involved in terms of what you do. How do you train to be a pediatrician,
Okay.
Dr. Hayes?
Okay. So
I mean, Dr. Smith, and later you, Dr. Hayes.
yes. So I did 4 years of college, and you don't have to necessarily be a biology major, but it can be helpful. But any major is fine as long as you have the requirements for med school. And then in college, you take what we call the MCAT. So back in my day, the MCAT was on paper, but now it's on computer, and offered, I think, once a month. So once you apply to med school, you take the MCAT, make sure your grades are good. Community service is always a must too, so make sure you're out in the community, and just it shows your commitment to the community as well when you do community service. And then once you getting in I think is one of the hardest things, one of the first hurdles to jump through. And then I did 4 years of med school. The first year of med school, first 2 years of med school, actually, you're literally like sitting in a desk for 8 hours a day just studying. And then you do even more studying after your class time is over. And then your third year of medical school is where you're actually getting to see patients. And you have rotations. And you do your rotations in medicine, pediatrics, psychiatry, surgery. And you do those rotations, usually about 2 months long. And that's when you actually get in and get to see people and get what you've been studying for the past 2 years, which is fun. And then you finish your fourth year where you take different things in your specialty, whatever you're looking at doing, either pediatrics or surgery. So after you finish med school, you're not done yet, you have to do residency. And residency is where you specialize in whichever area that you is your area of interest. And so mine was pediatrics. And so I did 3 years of residency at UT Memphis, which was great. It was a wonderful experience. I think Memphis is a wonderful place and a great place to train. And I did 3 years there, and then I was asked to stay for an extra year to be chief resident. So that's kind of all what goes into being a doctor. It's a long road. A lot of times kids will ask me, you know, what grade I'm in, and I joke with them that I'm in like the 24th grade because it feels like I've been in school forever.
Forever, and that's the way it appears.
Right.
And I would imagine those that are supporting you believe that to be true too.
They're tired of graduations. They don't want to go to any more graduations. They're done.
Good. Okay, Dr. Hayes.
Like Carlinda, I had to go through several steps before I became a speech language pathologist. The first step was to get a bachelor's degree, and it's very important that while I was in school that I made good grades. That was really important because you have to get a master's degree to become a speech language pathologist. That is the degree that is required. It's not a doctorate. That was extra that I did. But knowing that I needed a master's degree and I needed to get in grad school, when I was in school, I said, okay, I have to focus, because I'm going to be applying to schools and they're going to be looking at my grades. So did that, and then in order to get into a master's program, they wanted the GRE. I also think they take the MAT. I took the GRE, and so then you have to do your master's. You have to apply and get into your master's program, and it's very competitive. There are few speech language pathology programs around the United States, so that's why it's really important to study hard for the GRE and to make good grades so that you are able to get in. And while you're there, they have you to do clinical hours in addition to your coursework. And you do your clinical hours in medical settings, in a school setting, in a variety of different settings, because as a speech language pathologist, we work with people of all ages in several different settings, which is one of the most rewarding things about being a speech pathologist, is that I'm not just limited to being in the schools. I also work in the nursing home part-time, and you can work in the hospital. So in school, they have to teach you how to work in all those different areas so that you can be specialized in all the things that are required. Another area is the area of swallowing, which a lot of people don't know that we work on, feeding and swallowing and things like that.
Feeding and swallowing, that's some area, what does that mean?
Well, Sometimes when people have strokes, they often lose the ability to swallow or swallow safely. And so we would teach different strategies such as a chin tuck or maybe even thicken their food so that they can swallow without aspirating and the food getting in their lungs and so forth. And they would see a speech pathologist, a speech language pathologist for those services. And then after that, I went to after I finished my master's degree and got all my training, I was required to do a clinical fellowship year. And during that time, I work under a supervisor who trains me on the job and teaches me how to do my job. But I'm actually working as a speech pathologist, but I have someone teaching me and guiding me along the way for a year. And then after that, then I'm a speech pathologist, and so then you get CCC SLP, which is the Certificate of Clinical Competence in Speech Language Pathology.
Very good, and of course I think we're